you have knee pain with running, cutting, or jumping, and that pain is right here at this patellar tendon, well, it's possible you might have a little bit of patellar tendinitis, but don't worry, it's something that is fixable. And I'm going to show you a simple guide on how to rehab patellar tendinitis, or at least how I would do it in the clinic, so that you can get back to playing your sport or even just living life without pain. First of all, just a quick one-sentence summary on patellar tendinitis. It's basically an overuse injury of the patellar tendon that you got from running, cutting, or jumping a little too much too soon. Maybe you started running for the first time in years, or maybe you played a little too many games of pickleball or basketball. Now that tendon just had more than it can handle, and now it's flared up. So the first step to rehabbing it would be to kind of dial down those aggravating activities. It's like a scab. If you keep picking at it and taking off the scab, then it's never going to really heal, or it's going to take longer. But if you can temporarily dial that down while we rehab it, then you'll actually start getting better faster, just because you're not irritating it all the time. Next, let me show you some exercises. We'll do this here in my guest room. It's not a lot of space, but the garage is filthy and my family's still sleeping. But hopefully this shows that you don't need a lot of space to do what I'm about to show you. All right, now, before I show you this is important, and I want you to pay attention to this. So first off, if you have knee pain, always best to consult a doctor and physical therapist to make sure you're doing the right things, of course. Secondly, and this is where I really want you to focus on, if what I'm about to show you is painful, or we're okay with like a little bit of pain, as long as it's very small, goes away within 24 hours. But if it's a lot of pain, feels like it makes it worse, you can go ahead and stop. But it can mean one of two things. One is that either your patellar tendinitis is just very recently flared up, and within a few days, and really you just need to let it rest before you try exercising it or loading it. Or the second possibility is that what you're dealing with is not a patellar tendinitis, but actually something else. So some other options in that same area on the front of the knee are, maybe it's your kneecap or the knee joint that's painful. The other common possibility is that if you're a kid, or if you're a teenager watching this, or if you're watching this for your kid or teenager, you have to make sure that it's not something called Osgood-Schlatter's, which is more of a problem of the bone where that tendon attaches. Because kids are still growing, their bones are still developing. Sometimes that attachment there, that bony attachment, can get irritated. And what you really want to do is probably rest, don't do these exercises, and then get in to see a doctor or physical therapist to properly manage it, because you would handle it differently than what I'm about to show you. But all that being said, if it is a patellar tendinitis, then let me show you some exercise that might work for you. All right, so the first exercise I'm about to show you are isometrics. There's good research on isometrics that show that it can significantly decrease patellar tendon pain. All right, so I want you to try an experiment first. Okay, so this is what they did in the research. I want you to try doing a little mini squat, like a little mini pistol squat, like that, or you can even do this. You could hold on to something if you need to, but chances are that's painful. Now, we're going to try the isometrics and see if it makes a difference. So in the research, they did the isometrics on like a knee extension machine. I'm going to show you a simple way using just a wall, doing a wall sit. All right, so what they did was they had people hold that isometric exercise for a certain period of time. They had their knee at 70 degrees, around like 60 or 70 degrees of knee flexion, or it's bent 60 to 70 degrees, and then they push at like 70% max voluntary contraction. So in this case, I'm going to kind of replicate that around 60 to 70 degrees with my knees. I'm not going to 90. I know some people are going to be out there like, get your hips lower, go lower. But it may work at 90 degrees, but I'll just do it the way the research says, or at least the way they did it for that particular experiment. So this wall sit's going to work these quads. You're going to feel it here. You might have like just a tiny bit of pain to start off with. That's okay. But you're going to hold this for 30 seconds to 45 seconds, and then you're going to stop. You're going to rest for a minute to 2 minutes, depending on how challenging it was. Then you're going to repeat it 3 to 5 times. I think the research was 5 reps, but I've seen it work with some of my patients just doing 3 reps of it. After you're done doing that, then you're going to try that same step down, or since we don't have a stair right now, we're doing the squat. You're going to repeat it and see if you have any less pain. If it worked for you, let me know in the comments. If it didn't work, then consider what I said earlier, that maybe it's something else, or maybe it's just too flared up right now. You just need to let it rest. It's almost like magic, it seems like at times. So hopefully it worked for you. Isometrics are a good way to reduce pain. At the same time, get some strength. But that's not the only thing that there is to do for rehabbing patellar tendinitis. The next step is actually moving through a motion, not just holding that one spot. So it's going to further challenge your quads and that patellar tendon. There's a lot of ways to strengthen your quads. So I'll show you maybe just a couple of possibilities. Now the key is, it's not just doing the exercise, it's actually how fast you do it. So there's good research to show that slow movements are what's going to help strengthen and make that tendon feel better. First one you can do is, a lunge kind of motion. The key is doing it slow, right? So you're going to go down, 1, 2, 3, and then up, 1, 2, 3, down, 1, 2, 3, up, 1, 2, 3. Okay, maybe I count a little fast there, but slow is better. And depending on how your knee feels with it, or if it's or how strong you are, that'll affect how deep you go. You might want to start with less depth and then work your way up to more depth. If that's too easy, you could always hold on to some weights and try more of it. But the next more advanced exercise you can try is a Bulgarian split squat. Sometimes they call it a rear foot elevated split squat. But basically the way you'll set it up is, you can do this from your couch or a bench. You can sit at the edge, stick that leg out straight. Then you're going to stand up, and then you're going to put that back leg on the bench. If your balance isn't great, then you could hold on to like a stick or something to help you balance. But you want your feet still, like the width still hips width apart. You don't want that foot right behind the other leg, because then now it's a balancing act. Now you're in the right position, and then same thing with the lunge. You squat down nice and slow, and then up nice and slow. Down nice and slow. Up nice and slow. Okay, they used to say just do eccentrics, where you only do the lowering part and then you try to skip the going up part somehow or bypass it. It's a lot of, thinking about how to do it properly. But the new research is showing that you could just do both up and down, but slow still. And eventually you want to load it up, add some weight gradually over time as you get stronger. As far as how many sets and reps to do, I would aim for 2 to 3 sets of 8 to 12 reps. And then again, 3 seconds down, 3 seconds up, nice and slow. But that's not necessarily the end of all there is to do for rehabbing the patellar tendon. If you want to get back to running, cutting, jumping, you actually have to do a little bit of that, some graded exposure to it. So doing some plyometrics to gradually improve the tolerance of that tendon to those types of movements. But I'll probably save that for another video, and I'll put it over here whenever I do make that video. But hopefully this helps you with your knee pain. Let me know if it helped you in the comments, and then I'll see you in the next video.